remember on 3 we're going to smile and we'll start.
Okay.
So 1, 2, 3. Hi everyone, we're back. This is, again, Elizabeth, my resident nerd/nurse. And I wanted to post another video because I had some more questions come up as things have kind of progressed and changed over the last couple of days. So things that we wanted to talk about is, number one, just to restate, how is this different than the flu?
Okay, so the biggest difference between the coronavirus that we're seeing now and our regular flu that we see every year as it changes is that this is a completely novel thing to us. Our immune systems have no response. So we don't have any kind of herd immunity to it. We're really kind of laid bare if we are to get infected from an immune response perspective. We also think that even though we don't have complete data yet on how much of the population has been affected, the amount of deaths that we're seeing far surpass anything that we usually see with our flu. So it's been compared to the 1918 Spanish flu with a death rate of around 3%, which none of us living now remember that, but at the time, almost every family lost somebody.
Oh boy.
If you talk to people that had relatives, great-grandparents that were around during that time, they would share that information. So, what we're seeing in countries now is anywhere from a 3 to a 6% death rate. And, again, it tends to hit older people and people that have other illnesses. But that's really significant and definitely not at all like our regular flu, which usually has a death rate of 0.1%.
Okay. That's a big difference. Thank you. And then why the date of April 7th? Why 3 weeks out?
Yeah, so the 6 counties in the Bay Area are asking people to shelter in place through April 7th to give us about 2 to 3 weeks for anyone who is now infected with the coronavirus for that infection to either get worse, or they have to be admitted to the hospital, or for it to run its course and for them to get better without infecting anybody else. We do know that with this approach, like people in a household will probably infect each other. 3 weeks gives it enough time for everyone to kind of work it out of their systems.
Okay.
Hopefully for us to get ahead of these brand new cases that we're seeing.
Okay.
So that's why, the quarantine, shelter in place mandates for 2 to 3 weeks is really ideal to kind of get ahead of this epidemic.
Okay. And then you had a good talk with one of the attendants today at work, so I wanted you to share some information about that.
So one of our attending physicians today really created a very sobering moment for our team during our morning meeting. She just wanted to remind everyone that this is a public health crisis. Even though everyone at home is sheltering in place, when we come into work, I think we've been kind of just adopting our same old routine. But she wanted to remind us that we don't have universal testing. Experts are estimating now for every confirmed case, there's 5 to 10 people walking around in the community with coronavirus that has not yet been identified. So in a room of 30 people, it's pretty likely that one of us is coronavirus positive. And it's possible that we're spreading it to each other. We could spread it to our patients. So she was trying to remind us to always keep the 6-foot distance in between healthcare providers whenever possible. Only provide care to patients when it's absolutely necessary. Avoid unneeded touch and close contact.
And that's for you guys. And you guys are way cleaner than us.
So I think it's just a great reminder for everyone, in that we can't even understand the size and scope of this issue because we don't have enough testing in place. So even if you feel great, know that some people are completely asymptomatic. These aren't the people that we expect are really super virulent. That is, they're not putting off a lot of the virus, but some estimates say that they are responsible for about 80% of new cases because they don't know that they're sick. So they're touching people, they're engaging in close contact, maybe not covering their cough or sneeze, touching things, all these things we talked about in the last video, and they're propagating this disease to the population.
Just people who can get the virus are not old people.
Anyone,
it could be anybody,
including kids.
Okay.
Anyone can be a carrier, right? This virus does not discriminate. But people who are likely to get sick and die from it are old people or people that are sick with other illnesses.
Cool, thank you. And then we talked briefly about the hospital system and why it's so important to not overburden the hospital system. So I wanted Elizabeth to speak a little bit to that.
And I'm just going to get on my soapbox here just a little bit because so the real reason why we're doing this quarantine, this shelter in place in our counties is because we have some really smart people in our leadership who are listening to our public health officials. We as a healthcare system cannot withstand the burden that this pandemic will exert itself on us unless we control the number of cases that we have. Because of the nature of healthcare in the United States, hospitals who can't run near 100% capacity with maximum efficiency, like that means staffing, like the least number of staff to care for the patients they have, go out of business. So we have a large number of hospitals in the Bay Area, but we all run at really high capacity. That is, we have almost 0 beds open for these patients that are going to come in. We have just enough to take care of the patients that we usually see on a yearly basis. So if you're talking about, a 6% death rate, that's probably like a 30% hospital rate. These are people that we have no room, no beds, no ventilators. And I think even if you don't care that 3% of our population could die because they're all old people and you're young and healthy, you have to realize that the people who will come into the hospital that are sick with this are going to take up beds from elective procedures. You could have compromised care, like let's say you get in a car accident. If there's no nurse or provider to help care for you when you come in because everyone is jumping to the rescue people that have coronavirus, then you're not going to get the kind of care that you deserve. So all of this effort is just to decrease the load and burden on our healthcare system so that it doesn't collapse. Because it's scary to say it, but it's actually a very possible thing if we have a huge influx of patients that need ICU level care.
Whoa, so thank you. That's pretty serious. So this is, I wanted to post this again just because I think that this, as more rumors are still circulating about like the comparison of the flu versus this virus and why people are not really taking it seriously, why they need to do the social distancing and staying at home. This just wanted to speak a little bit deeper about some of these topics. So.
And can I just say, I just wanted to say thank you to everyone who is adhering to the shelter in place and practicing social distancing from the healthcare community at large. I want to say thank you. We do realize that this is a lot of inconvenience. I mean, heartache. I mean, this is a huge compromise for a lot of people. And I know that it can be difficult if you don't know where your next paycheck is coming from. But from like the bottom of my heart, on behalf of all of healthcare providers, I want to thank everybody for this because it's really saving our healthcare system. And it's really makes me so hopeful that we that the 6 counties in the Bay Area have made this proactive decision to do this. Because we could have just said, we don't care. People are just going to get it. People are going to die. And we would have had this huge catastrophe in healthcare and would have all kinds of consequences for generations to come. And there was a really good meme, sorry, I keep talking. There was a really good meme that someone posted about the conversation between the public and epidemiologists, and how, best case scenario is people complain about how we did all of this stuff and no one died, right? Like, we did everything for nothing. Like, no one even died. That's the best case scenario. That's what we're aiming for. And I know that it seems hard in the moment, but it really makes me so grateful and so hopeful that people are coming together to do this.
Cool. Well, good job, everyone. And thank you, Elizabeth.
Thank you.
We'll talk to you again soon.